this live broadcast because we all know what happened in West Bengal. We know about what happened to the resident doctor. So today we are going to bring you in-depth detail why doctors in India are not safe. What is happening? What is the ratio of doctors? We have several guests who are doctors themselves, and they are part, or they have been part of the resident associations, FORDA, which really takes care of the resident doctors or the trainee doctors. There is a lot of detail that we want to talk about. There are so many things that we want to discuss, and it all comes to the safety of doctors and especially of the female doctors. We do understand that how many patients we do have in India and how less doctors do we have. There was a time when even I wanted to become a doctor, but we do understand that what it takes to become a doctor and why they are important for our country, where we have millions of patients who are going to hospitals on a daily basis. Now I just want to introduce you to my panel. We have ex-president of FORDA who will be joining us now, and after that we'll also have the president of FORDA who will be joining us. So there's a lot that we want to discuss. We want to discuss what is the core solution and what has happened this time and what the government can do, who is responsible for it, and what needs to be done. And we'll also take you through the 2019 bill and also what happened in the past. We know Dr. Balwinder Singh for quite a year. I know him for quite a year. I have covered all these details and what happened in the past. There have been several incidents. Now we are talking about this college rape and murder of West Bengal because, of course, the details which are coming in from the case are really bad. Now, Dr. Balwinder, very much thank you to be here and joining us. I know it's difficult times for the doctors, but first of all, I want to ask you, what was the detail that you got first, and what were the details that you got in the beginning? And today, after the case has been handled to the CBI, what do you have to say to the government and the people who are associated with this case or who are fighting for this cause?
So the resident doctors of India, they are working more than 24 hours a day. I think more than 24 to 36 hours a day. The life of the resident doctor is very, very tough because the first the patient first come to emergency. The resident doctors are there who are treating them, and
Right.
all the pressure. The first the doctor, the first junior doctor is resident doctor who is facing the all pressure of the patients. This
So he is
horrifying
someone, the
incident.
junior doctors are someone who are the first ones to get in touch with, with the patients. Most of the times it is not the seniors. Please explain how difficult it is for the resident doctors because they are almost always in the hospital. They never leave the hospital.
Yeah, the duty of a resident doctor is to stay in the hospital. First, in emergency, the patient comes to a resident doctors. The first treatment given to a patient is given by the resident doctor, and there's a huge
Right.
rush. You know, Safdarjung Hospital, also RML Hospital, all big hospitals of India. In emergency, whenever you go there,
Yeah.
24 hours, there is a big rush in the hospitals. The thing was that many years, like in 2014 also, 17 also, all these protests, strikes that are happening in the medical colleges, all these strikes, 90% of these strikes are due to this violence against doctors. But it's very, very
Right.
shameful that nothing happened till now. No act. In 2019 also, the health ministry, they drafted the Central Protection Act for doctors, but nothing happened. And all the problem is the doctors are facing is because of this security reason. So this is the need of a hour.
But you have been
We need a,
ex-president.
yeah.
So you have been
We
ex-president. You know what is the entire, ordeal or
Yeah,
what is the deal
from
around it.
2000
So I
to
also want to understand.
yeah.
I also want to understand
Fr-
that how this situation could not be changed for over the years, why the things cannot move further. and it is still stuck to 2019 drafted bill. What does it say? What will it change for doctors? There is a lot to discuss, and of course we'll go to the complete closure of OPDs in many hospitals. So there is another issue that the patients are also facing. This is the other side of the story. We'll go to that as well. But I want to understand that over the years, why FORDA in a way has failed to achieve something that could really make priority of, prioritize doctors, the safety of doctors could be prioritized.
Because government is not serious about the Center Protection Act for doctors. All the protests, you see all the protests, 90% of them are because of these security lapses and this assault on doctors. We have, like, in all hospital, we
Right,
have these police stations also. You have seen many times there are small police posts also. But these police posts, they never take
right,
rounds in the hospital. They are only for the VIPs. They just bring police officers to the doctors to get medical or like for the treatment. But the main role of these police stations, which are built up in these hospitals, they never take rounds in the hospital. Nothing happens because nobody is serious about this. Even the government is not serious. In 2019, they drafted a bill, Center Protection Act, but nothing happened till now. I don't know what they are waiting for.
right.
Now the time has come. We need a strict law against to curb the violence against doctors.
Why, the question that many have, who would say that why doctors should be given that preference, why, extra security for doctors. So I want you to explain how difficult is it on a daily basis, how is the life of a resident doctor? If I tell you that five top challenges that they are facing, what will be those, and why this security? The kind of patients that you see, the kind of families that you face on a daily basis.
First most challenge is this one only. This the violence against doctors, and second is the long working hours. They are working more than 36 hours, and now many cases we are
Right,
seeing many cases of depression because doctors are not taking care of themselves, their families also.
right.
Lack of hostel facilities. You have seen the conditions of hostels of resident doctors. There are many,
Right.
many, many things that
And
resident doctors are facing, and even they are working so much, and after that they don't get time for their studies also, and sometime after 3 years when they have to give
right.
their exam, they can't pass the exam after working so much.
But Dr.
So
Singh,
they
now also the other side that we want to touch, how would you deal with this situation? Of course, there are protests and OPDs are shut. AIMS has also said that they will take action against protesting doctors. So how long is it going to continue? How do you think it is going to end, the entire protest and this scenario that we have in hand right now?
this horrifying incident, this is very horrifying incident, and we as a doctors want this should not happen again in future, and the government should think to how to protect these things. They should get that center protection law. It's not a big deal. Those working day and night. Imagine, like, a female doctor working in the night from 9 o'clock to and next day 9 o'clock, and how the people of
Right.
India, some come almost, they are sometimes they are drunk, abusing, and we all
Also,
many times we demanded the government for one patient one attendant policy. In hospital there should be one
right.
patient and one attendant, but when you go to emergency, there is one patient and like 20 30 attendants with them, and they are making the problems in the hospitals.
I have a doctor
The time.
friend, I'll tell you about stories of very small towns or the two-tier cities or three-tier cities or the villages that we have in India where we have very less hospitals or most of the people, they rely on government hospitals. So, there are situations if you are giving a treatment, if treatment works, it is all fine. But just in case the treatment doesn't work or the patient came in such a condition that he cannot be revived, So in these situations, how do you deal with these situations? My friends tell me it's very tough. Sometimes they just refer the patient to some other hospital or the bigger hospital because they don't want to, go through the entire crowd who is there to tell them what to
Yeah,
do.
yeah, it's true. It's true because sometimes we get a patient uh, like very serious patient, and sometimes we try to save that patient, and sometimes we are lucky, and sometimes we are not. And when we are not, then the people they just come to fight with us and blaming the doctors that they are responsible for
Right,
the death. And 90% of the patient or the doctors are facing this problem. That's why most of the time that when
right.
the
So
some
when
the, most of the time when there is one patient in PSC or one doctor in PSC and facing so many people there, then they refer the patient to higher center so that the patient get a good treatment there.
Yes, I just like to take you through some of the data that is there. And these are, of course, very shocking data that we have. It says that over 75% of doctors, they have faced violence at work. This is what one of the studies, it says. And the doctor population in India is such that we have one doctor for 834 patients, and that has been said by the health minister. Well, if I tell you the figure around the world, then it is still better. So you can understand what is the lack of doctors that we have in the world. So they are precious for us, and then they are treating in such a way, they have been harmed. The details that we have are horrific details of the murder that happened in West Bengal. But we do have lack of doctors in this situation. When we demand, there is a bill that has been demanded, that is to punish people who assault on duty doctors and the healthcare professionals. There should be a jail term of at least 10 years that has been demanded for very long time from 2019. And the IMA, they also gave ultimatum in the past that there should be action. The bill should be passed, but nothing has happened for now. Now we have a health minister, a new one. Earlier it was Mansukh Mandavia. Now let's see how it all goes, and if the government shows some seriousness. But at the moment, we do know that the case has been given to CBI. There will be proper investigation, but this doesn't solve the issue that the doctors are facing on a daily basis, especially the trainee doctors who are always in the hospital, and their security should be something which is a top priority, because they're always in the hospital with hundreds of patients all the time. And it is not just about a shift that they are doing, they are on multiple shifts throughout, like they don't take any breaks. And this is real. This is not something that is happening at just one place in India, but it is the condition overall in entire India. So of course the situation is grim. We will also be joined by the current FODA president, and he will tell us more details that what is going to happen about the protests that are going on. Of course, we will ask our viewers, if you have any question from the FODA president, from our guest, from us, please write it in your comment section so that we can respond to that, and we'll have more details. We'll be joined in by the FODA president. Now, I'll just ask Dr. Singh how much time you have. I know that you have a limited time and you have patients to attend as well, but I'll just take few more minutes of you and just want to ask the last question from you. How do you see what is happening in the OPDs, what the doctors will do, what is FODA's next step, what can be FODA's next step, how long these protests are going to continue, and also tell us the situation that you see in your city. How is the situation in your city?
Though the doctors are not protesting, this is the situation because last time also the government assured us to form some Center Protection Act for doctors, but nothing happened. Now every time some things happen, like this horrifying incident happened. Now again we doctors are united and we are demanding the same. And after that we will after this this incident we will again go for to our OPDs and work and to surgeries, and we will forget all these things again after 2 3 years. this same thing will happen again and again. So I request the government to please
Right.
implement this Central Protection Act. This is not a big thing. It's not like just a small thing to stop this violence against, to curb the violence against these doctors. They can do it.
Right.
We can only protest.
Thank you. Thank you so much for your
Thank
time,
you.
Dr. Singh. I
Thank you.
know your busy
Thank you, sir.
schedule. We have spoken about how is the situation for doctors in India. Now we have been joined by the current FODA president, Aviral Mathur. Thank you so much for giving your time. I know, Aviral,
Thank you,
that
sir.
you have been asked by so many places to continue speaking about doctors on their behalf. Thank you for joining in One India. My first question, Aviral, what was the detail that you received, Dr. Aviral, when this incident happened in Kolkata? What were the details you received? And could you please take us through what FODA knows about the case and what is going to happen? And of course, we'll talk more.
Yeah, hi. Thank you for having me. I think my regards to my senior, Dr. Balvinder sir. He has led the association for long and for good. What you asked, that how were we first informed about the incident, was that it came to us on my personal WhatsApp account. I got the information that such and such incident has happened from a resident who is in a hospital, who is undergraduate from the same. After that, we had an urgent meeting within ourselves. We asked what is happening on the ground. There were many allegations. There was a lot of confusion. Nobody was sure, who has done it, how did it happen, what is the extent of the crime, how grievous it is. And soon as things started to clear, we decided that there is an element of suspicion in this, in the regard that maybe the investigation is not being done the way it should be, and maybe the administration or
Right.
the local police outpost and everybody who was a part of the security detail in the hospital, they were trying to maybe cover up. That was the sentiment. That has been the sentiment of the institute overall. So we immediately sprang into action. We knew that we have to get justice, and therefore everything happened sooner than it could. Generally, it's always graded and in a very timeline manner, but in this case, it was done pretty quickly because the situation was so grave and demanded rapid actions.
But would you call it? Would you call it? Was it attack on the doctor? Doctor, of course, she was there in the premises. But I just want to understand that. Would you call it just the attack on the doctor? It was more, the attack against a female, against a woman, the crime against woman.
See, anything of this magnitude, uh, she was a woman first, she
Right.
was a female first, a doctor later. And I feel that anything of this magnitude occurring is sad and unfortunate for any female in any profession, anywhere in the world. So, as a mark of solidarity, I would have stood by her if she was not even a doctor. Maybe I would not have gone on strike because that did not concern my profession.
Right.
But, we would have we would have participated, and we would have expressed our deepest condemnations. But since she was also a member of our community, she was a resident doctor. She was, a very much an asset to this country. So therefore, this demanded
Yes.
a strong retaliation. This is the first time that such a gruesome thing has occurred to an on-duty doctor, and this should not be a precedence for future.
And for protection of doctors, you have been fighting for the bill. We have met in the past speaking about it. I just want to understand that how do you see it moving? The overall security of doctors while they are at work. How do you see it growing? Is it going to get some pace? Or what is going to happen? There have been so many incidents that have happened in the past.
Yeah, of course. Again, what you say is true. There have been some protests in the past regarding violence against doctors and for the implementation of the Center Protection Act. This, however, is a little, demand which has been the backbone of every complaint against the act of violence. So I know that it is of a repeated nature. There is a constant demand that comes from our end. Sometimes it gets addressed, but then everything goes back to usual. So this time we have modified it a bit.
Right.
As you could see in our press letter, we have demanded a ratification committee because forming an act is one thing, drafting it, then putting it to the table in the parliament and getting it approved. All of this is a part of the ratification, and there should be a committed committee who ensures that all the roadblocks are
Right.
cleared. And we hope that we are a part of that committee also, because we can then implement and ensure action.
I know you have a very busy schedule. I know you just had 10 minutes. Just the last question that I want to ask you, and that is about the patients and of course what AIMS has said. AIMS has said that they will take action against the protesting doctors. So last words about that, and also the OPDs which are shut across India at many hospitals. What would you say to the patients who are there waiting in queue, so many treatments pending?
So again, again, I would like to say that it is my earnest request, with my folded hands, to the general mass, to the patient community, that our profession is such that any act of aggression that we do, any act of retaliation that we do, naturally patients suffer the most. But this time, this I think I would show you if I could. I have letters of support from my patients. Patients are sending us messages that we are with
Right.
you. This is wrong. What has happened? And of course, as a mark of solidarity, even for the patients, we have not hampered the emergency services. Only the non-emergency services, we have withdrawn ourselves from it. There are always other strata of doctors working in a hospital. So the hospitals are not closed. It is only the resident doctors who have withdrawn themselves from
So
the
for the
services.
patients,
And
just to clarify, for the patients, you are saying that the emergency services are there. Of course, the operations which were pending, are those happening if they are very serious operations, or the urgent operations are
see,
needs
any
to be
any
done?
life
All that is
saving
in place.
any life saving, limb saving, any urgent surgery, any urgent medical care, any critical patient, anybody who has, life in the balance here, life in the question here, is being dealt with
Right.
even by our resident doctors. Okay, so this is a common misnomer that is being spread. This is misinformation that is being spread. Doctors are there. Doctors have been supplemented. Doctors have been bolstered in the emergency departments. Our numbers have increased there. Naturally, not everybody is coming to the strike. Some are working, and they're catering to all the sick patients, critical patients, making sure nobody dies on their watch, which they have not until now. And we always have patient interest at the core. And believe it or not, this strike is in the long run going to benefit the patients. It is hard to believe, it is very counterintuitive, but
Overall,
a happy
can you
doctor,
give
a
us
safe doctor
this
does
strike
better.
end, or
Pardon your question, please.
but when do you think this strike would end? That's already been given to CBI.
See, we are discussing, we are taking it on a day-to-day basis. As and when developments happen, our demands, mostly we are happy that, the pressure buildup has led this case to be handed over to the CBI. We are talking to all the resident doctors across the country. We will talk with the ministry if needed, and arrive at a conclusion which is beneficial for all. So we don't have a timeline in mind about when are we going to continue this for, but of course, it will no longer, not more than what is necessary until the demands are met. I can assure you
Right.
that.
Thank you so much. Thank you so much
All
for your
right.
time, Dr.
Thank you.
Mathur.
Thank you.
I know you have a busy schedule, and I will.
Thank you.
I'm happy that you gave us the time and we could discuss it at length, and
Thank
hopefully
you.
things will
Thank you.
come to place. And we also have Diwan, and he is joining us from Jammu. We want to understand what is the situation there. Dr. Diwan, he is the General Secretary Association there in Jammu. So, Dr. Amit Dwan, sir,
Yeah,
are the patients coming in? Is there a long queue, or how is the situation?
the situation is same. Actually, the people are coming for OPD services, and although hospitals are full, there is no such decrease in the number of patients in the hospital settings. People are very less concerned about, or they are not misinformed about the OPD services. Are actually we have given the statement yesterday only that we are unable to continue our OPD services in the GMC, but as in the peripheral settings, as we are working in
Right.
different districts of Jammu, we are continuing our services at all the levels.
How satisfied are doctors action of the case? The case after the autopsy report came out,
Yeah.
CBI, and CBI will be investigating. So, are the doctors fraternity, are they happy with this decision, or they think to be done?
Yes, this is the basic demand. Actually, we across the country, wherever you see there the protests are happening, the basic demand was to conduct to inquire the matter through CBI. So there is a little bit a faith issue with the state police. That's why all the people across the country, wherever the protests are going on, they just wanted CBI inquiry, and we are happy with the government decision that the CBI entering into the this case, and hopefully we see the good results and positive outcome from this case. And what one thing which I like to request government to actually intervene is to provide what is the basic actually cause of all these things. you know it's a, lack of security and laws. Yeah, am I audible?
Overall, there is no working late, overnight, so no security, single constable near their chambers. That is the fact we know. But you can tell us more about doctors, how it is different than not being a resident doctor or a trained doctor. What is the difference? How does it make it more problematic for the resident doctor, and take most of the pressure from in the case when you have so many patients? That not a a thing that happens just.
Yeah, since resident doctors are the first contact between the patient and the attendant, so whatever the public wrath, the public frustration, they have to face all that. It's a resident doctor who are the first victim, who are the first handler. They see the patient, they treat the patient, but
Yeah.
there is a lot of frustration, and there is a lack of patience in the attendance. Everybody, each and every patient coming to the hospital, they just want VIP treatment for their patient, in spite despite the situation whether their patient actually need emergency, it is in the emergent condition or not. If there is a life threatening condition, the resident have to first see
Right.
that patient which is in the danger zone. So but this thing is very less acceptable
So
for the attending.
how many patients do you I want to understand, doctor, on a very personal level, I want to understand that how many patients would you see on a daily basis in Jammu? Just to understand, the conditions of hospitals.
Actually, in the emergency, you say there is a trauma. There are number of patients coming with the trauma, with the road traffic accidents, some with poisoning, some with attacks by violence between the two groups. For there are quarrel between the different groups. So every there are number of patients. Footfall is
Yeah.
around 100 to sometimes it's 200 per day in the emergency, where you see traumatized patients, and about 20 to 30 patients they need surgery, whether in the orthopedic department, whether in the general surgical department. Sometimes it's a head trauma, we have to call a neurosurgeon for those treatments. So these sick patients actually require uh, only 20 to 30 patients out of 200, they require main attention. But
Right.
those 170 or 180, they expect the same kind of treatment and same kind of attention from the doctor. Say we have to look which case require more attention. So this thing is not able to, attendant won't be able to clear understand this situation, that why the doctor is giving treatment more attention to this patient. So this is the reason, I think, for their frustration, and sometimes this is misbehavior with the
So
resident doctors.
there should be one layer. There should be one layer between patients and doctors, at least one layer to keep them away and let the doctors decide what is important for the patient rather than the people, the attendants coming in with the patients.
Yeah, that's why I called. I
That
just
would
uh,
that would really provide you a
almost.
safer environment.
Yeah, actually, security barrier is for this thing only. The security people can matlab scatter the out number of attendant with the patient, na. So the maximum one patient is followed by
Right,
about
right.
20 to 30 attendants. So sometimes it is doesn't require so many patient number of attendants doesn't required in the emergency.
Doctor, one thing, have you ever faced this situation on personal level? Did you ever face, and if you could just tell us what happened or what kind of situation you have faced personally being a doctor?
Yeah, there are number of incidents. How many I remember. Sometimes there is a case when I was
Something
in a
which
senior.
was just horrible, just was something that you would really want
Yeah,
to tell.
actually, one of the patient, he was elderly patient. He was on some on medication. He had some overdose of the medication, and the patient was brought dead in the hospital. But the attendants were reluctant. They won't be able to understand whether that patient has gone, but they actually they called our seniors and hospital administration to admit the patient in the ICU, despite being the fact that the patient is no more. But they still insisted.
Right.
Uh, but when I resisted, so one and two of them who the attendants, they were drunken at that moment, and they mishandled with me. But as the situation, I know that I have to keep my nerve calm, because in this situation there are always the chances of the things getting worsened. So I kept my nerves calm, to then explain the situation to few of the attendant who are in good state of mind, so that they can they understand the things in a better way, and
Right.
that in this way that I just bring the settle the things.
We don't want these kind of situations to be happening
Yeah,
with the doctors as well.
this is a normal
Go
situation
through on
you
a
face.
daily basis. with
You know,
others or the other profession.
yeah. There are number of
Yes, Dr.
situations.
Diwan.
There are number of. Sometimes I don't know whether you remember or not. In 2023, one doctor in South India, something in the Tamil Nadu, she was stabbed to. She was a surgery resident. She was stabbed to death.
Right. Yes. And there are multiple incidents. I mean, I joined the FODA group or just started speaking with doctors because of these sort of incidents that happened in 2017, then 2019 when the bill was discussed. So, of course, there is a lot to it and it is not something new. Of course, we are talking about it today. This has become the headline because the horrible incident or the kind of brutality that happened with the resident doctors. But the situation of the doctors that they are facing on a daily basis, it's incredible how the situation is, and especially when you go to the small cities, small towns and the villages where we have mostly the government hospitals are being used. Of course, in Delhi we know the hospitals are full of patients. There is no hospital that you can say is not overloaded, or the people working there, the staff are not overworked. But this situation, I think Dr. Diwan can tell us that the situation hasn't changed at all. It has remained the same.
Yeah, the number of
It's
patients,
more about the details of the situation, the workplace. It must be a crazy situation.
yeah, the number of patients, the footfall in the hospitals is increasing day by day. Sometimes, there are long queues. Patient goes unattended because of the timing schedules. One have to sit for 5 to 6 hours in a day to see the number of patients. But when the number of patients are more,
Right.
you won't be able to focus on their treatment. You won't be able to explain and calm their nerves. Every patient have different set of questions. You won't be able to answer all of the questions, and this is the reason. That's why the patients say, they are losing faith in government setup. The patient turn to the OPDs in
So
the evening for the private doctors.
even the quality of the treatment suffers because of the kind of pressure that doctors have to go through.
Yeah, that's it.
Okay. Well, thank you so much for your time, Dr. Diwan. I know as others, you must be also taking care of so many patients on a daily basis. Thank you so much for your time. But before we wrap up the program, let me take you through to what the president, IMA president, has said, and of course they have sent a letter as well. I would just like to remind our viewers that what has happened throughout the day. The woman, the 31-year-old woman doctor, was attacked at the state-run RG Kar Medical College, that's in West Bengal. Now the swift action has been taken. That's what the government says. That they have taken a swift action. The case has been handled to CBI. The reports, the autopsy reports that have come, I would definitely not go to the entire detail because it's horrible, horrible what has happened with the doctor. She was a resident doctor, a trainee doctor. We connected with the FODA president, ex-FODA president, to understand the challenges that are faced by the resident doctors, trainee doctors. They are taking most of the pain throughout the day because they live exactly in the hospital premises, in the campuses, and they are called whenever there is the requirement. So you can understand the kind of pressure and kind of work that they have to do on a daily basis. So doctor's profession is something we all respect in India, but about their working condition, it is very difficult that someone would speak until and unless events like these happen and people suddenly wake up, and that too only happens when there is nationwide strike, when the OPDs are closed. Then there is sudden panic that why doctors are not attending the patients. But doctors want to be safe. We already discussed many doctors that if they are not feeling safe, even your life, your treatment gets impacted, the quality of the treatment gets impacted. So there's a lot which is attached to it. Of course, we will raise this issue again. There are so many things to discuss. We hope that swift action will be taken. CBI will take the swift course. The action will be taken. There are so many evidences which have come out, the CCTV footages of how Das, the accused, he entered into the premises and what all happened. But now at the end of the show, we just want to leave you with what the IMA president has said, and the letter has been sent to the health ministry. Thank you so much for your time. Thank you so much for joining in, and we'll be back with some more news in some time. This is Nagain Singh for Times of India. We leave you with the IMA president's bye.
Our demands are twofold. One, to the union government. The union government, the demands have been pending for the past 2 decades. One is to declare the hospitals as safe zones. What we have in mind is a clear, structured security, layered security, something similar to the airports. Entitlement of an hospital, how an hospital will be recognized. So this has to be defined by law and enforced by the local authorities. And the second one is a federal law. We have acts, state legislations against violence against doctors, healthcare workers and hospitals in 25 states. But on the ground, it has found to be not useful or not practical because a central law is not there. We have been demanding a central law, and we went halfway through with the government in 2019 when a draft law was put up. But somewhere it has been held up. And it's time that they have a relook at the central law. For the state governments, the demands are very simple: conduct a very decent probe, time sensitive, and come out clean on this, and also study with an inquiry the enabling factors of the gaps in the administrations. And the third thing is to look at the basic amenities for the young doctors, resident doctors who stay there. The corridors should be safe, especially for the women doctors. In a situation, more and more doctors are women doctors in India now. So I think it becomes the responsibility of the government to ensure to the parents that their daughters will be safe in the hospitals. Well, yes, he has given an appointment at 2:30. We will be meeting. Myself and my Honorary Secretary General, Dr. Anil Nayak, we will be meeting him.
Sir, do you have any plans to meet CM of West Bengal?
We are flying to Kolkata tomorrow morning. Our state branch is right now holding the ground and organizing meetings. Tomorrow we will be meeting the Chief Minister of West Bengal and we will press for yearly resolution of our demands.
Don't miss out. Follow Oneindia for real-time updates.
Our demands are twofold. One, to the union government. The union government, the demands have been pending for the past 2 decades. One is to declare the hospitals as safe zones. What we have in mind is a clear, structured security, layered security, something similar to the airports. Entitlement of an hospital, how an hospital will be recognized. So this has to be defined by law and enforced by the local authorities. And the second one is a federal law. We have acts, state legislations against violence against doctors, healthcare workers and hospitals in 25 states. But on the ground, it has found to be not useful or not practical because a central law is not there. We have been demanding a central law, and we went halfway through with the government in 2019 when a draft law was put up. But somewhere it has been held up, and it's time that they have a relook at the central law. For the state governments, the demands are very simple: conduct a very decent probe, time sensitive, and come out clean on this, and also study with an inquiry the enabling factors of the gaps in the administrations. And the third thing is to look at the basic amenities for the young doctors, resident doctors who stay there. The corridors should be safe, especially for the women doctors. In a situation, more and more doctors are women doctors in India now. So I think it becomes the responsibility of the government to ensure to the parents that their daughters will be safe in the hospitals. Well, yes, he has given an appointment at 2:30. We will be meeting. Myself and my Honorary Secretary General, Dr. Anil Nayak, we will be meeting him.
Sir, do you have any plans to meet CM of West Bengal?
We are flying to Kolkata tomorrow morning. Our state branch is right now holding the ground and organizing meetings. Tomorrow we will be meeting the Chief Minister of West Bengal and